Okay, Gail, it is 10:01. Why don't you start us off?
Sure. So I'm Gail Matheson. I'm a Minot librarian. And also with us is Orvi Dingwall, who's the head of outreach services. And today we'll talk about searching for health information. So I'll start with our land acknowledgement. So the University of Manitoba campuses are located on original lands of Anishinaabe, Ininuak, and Sininuak, Dakota Oyate, and Dene, and the national homelands of the Red River Métis. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. So we're using Zoom Webinar for today, and you have a few options that you can choose. You can turn your closed captioning on or off, and feel free to enter any questions that you have into the chat box at any time as we go through, and we can answer them for you. And you can also use the React features and give us a thumbs up whenever you want. So for today's session, we're going to talk a little bit about Minot's primary library services. Then we're going to get right into it and talk about the 5 steps for finding health information, and then how to choose resources based on your information needs. So what is Minot? Minot is Manitoba's Health Information Knowledge Network, and we provide our library service through the University of Manitoba Health Sciences Library. And we provide service to the staff of Manitoba Health, fee-for-service physicians in Manitoba, and to staff of participating regional health authorities. And the different regions that we provide service to: Interlake Eastern, Northern, Prairie Mountain, Southern. The one exclusion is the Brandon area. But if you provide service to communities outside of Brandon and you're not really sure if you qualify for our services, please just contact us, and we're happy to help you through that and determine whether you can have access to our services or not. So our Minot team, Orvi, who's the head of outreach services, myself, who's a Minot librarian, and then Cheryl, Pam, and Kathy are our library technicians. And if you send an email to us or give us a call, they're usually the ones that will be answering your requests. So Minot library accounts are free. All you have to do is complete a BOR registration form. And if you go to our website, the form is there for you to download. You just have to complete it, and then you can email it or fax it back to us. And then we will get you set up with your account, give you your library account number and your password, and get everything ready for you. So our library services, we have literature searches. So if you have a research topic or a question that you want information on, all you have to do is send that to us, and then we can do the searching for you, go through the different databases, conduct the searches, and then we'll send you a list of resources and citations with the abstracts, and then you can have a look and see which ones you'd like to read the full text of. Then you can use our document delivery service to order those resources from us. But you can also use our document delivery service if you find a citation in an article that you're reading, or a book, or you've done some Google searching and you hit a paywall. All you have to do is send the citation to us, email it to us, and then we will get you the full text for free. Don't pay for anything. We also provide access to UpToDate, which is a proprietary patient care resource. And I'm going to talk a little bit about it later on, so I won't say too much, but you'll use your library account to access UpToDate. We also offer training, that's okay, training, education, and orientation sessions. So if your group, you think some of the information we're talking about today would be helpful for the group that you work with, you can just let us know, and we can set up a session with you on maybe searching PubMed or Minot services, or we can customize something. Or maybe you just want a little bit more information yourself on how to search PubMed. We can set up a one-on-one, and we can do virtual or in person for those sessions. And then the last service we have here is current awareness. So if you want to stay up to date on a particular topic, or you have a favorite author or a favorite journal, we will send you a weekly email with a list of citations on those things. Okay, and I'll throw it over to Orvi to start us off with the 5 steps of finding health information.
Great. Thanks, Gail, for providing that overview about MyNet. And now we'll launch into, probably for the next 40 minutes, about the 5 steps you need to consider when you're searching for health information. So the first part is to start by asking a specific question. So when you're, before just like diving right into any kind of search engine, really think about, what is it that I am interested in or that I need to know about in this moment? So I've got a poll here because we would like to, and my screens are just, my screen is just a little sensitive. So it's just taking me 1 second to launch it. But we want to know, so if you can participate in this poll, are you familiar with the PICO strategy? Population, intervention, comparison, or outcome. So just let us know. This helps us just know who's here in the session today. And it also gives you a little something to do. Okay, I'll give you just one more second here. Most of you have answered. There we go. Okay, I'll end the poll, and most of you indicate that you have not heard about PICO. So good thing that we're covering it right off the top. PICO is just an acronym: Population, Intervention, Comparison, Outcome. There's another one called SPICE, has the same kind of thing. It's just a way for you to frame, help you frame your question. So we have a sample question here about oral supplements and vitamin D, whether it's best to give vitamin D alone, combine it with calcium, and thinking about pregnant women and then the outcomes for maternal and neonatal health. So we have all these ideas in our head, and using PICO just helps structure the question so that when we go to search for this information, we can do it in a structured kind of way. So the population here is the pregnant women. The intervention is vitamin D on its own. The comparison is the vitamin D with the calcium, and the outcome is the maternal and neonatal outcomes. So it can be really helpful just as you're starting to search or you're starting to think about something. Just you can write down PICO and then just kind of start jotting down, like, who is my population? Who am I thinking about? What intervention am I thinking about? Are there comparisons? What is the outcome? Taking this step up front can be really helpful before you dive into any kind of search. Now Gail. Yes, Gail? Yeah. So me. Sorry. Then we think about how we implement, we're still, oh my goodness, still on search strategy. So now we take this our PICO question, and we can map it into a bit of a search framework. So you can see that under population, we know we're talking about pregnant women, but this is our chance then to think about synonyms or other ways that we can say pregnant women. Maybe it's just pregnancy, prenatal, maternal, gestational, all those kinds of things. You start mapping those out. Are there other terms for vitamin D? Maybe there's a proprietary name for it. Maybe it's called something different in different countries. Maybe we commonly use a non-English term, all those kinds of things. And then similarly for the outcomes that we're thinking about. And again, you're thinking like, oh my gosh, this is taking a lot of time to map out just what I'm asking for. I already know in my head what I do. Sometimes you might have it all in your head and it might be really quick to do. And other times you might find it takes a little while to think through, who really is my population? So going through this exercise, really a helpful starting place. Okay, now it's time to take it over to Gail.
Okay, so the next step is identifying the sources and where you're going to be doing your searching. Depending on what kinds of resources you're looking for, it may determine what you choose to start your searching in. So we have another poll question. Just curious to know, when you look for health information, where do you look first? And we'll just give you a minute just to respond. Okay,
Looks like everybody's logged it in.
good.
Lots of Google and lots of, it depends.
Yeah, no, that's great. And hopefully you get a few more out of today. Okay, so we'll start off with UpToDate. UpToDate is a clinical decision support tool. It includes more than 10,500 topics. It has a drug database. It has some patient education resources. So if you're looking for something with plain language to provide to a patient, it has some great resources there. And it has some great medical calculators that you can use as well. So it's best if you're looking for an overview of a topic, you're just starting your search, maybe you don't know all of the different keywords that you should be searching. You just want to start somewhere. UpToDate's a good place to start. A lot of clinical topics. So if you're looking for procedural information, step-by-step instructions, drug information, it's a good place to go to find that type of stuff. It's really easy to search, and to get to it, you'll start off by going to our website, and then we have an UpToDate tab, and you'll click search UpToDate, and it'll ask you for your library login information, and then it will take you to this page. And you're just going to type in your keywords. And with UpToDate, you might find that you need to stay a little bit broader. So you'll notice on the next screen, we've just done vitamin D and pregnancy. And UpToDate has a bit of a smart search. So in the highlighting, you'll see it's highlighting obstetrician. So it's linking obstetrics with pregnancy while it's doing that search for us. So you can be a little bit broader. And you'll also find, in comparison to like PubMed, where there's a lot of clinical research trials, you can be really specific. With UpToDate, the entries are a little bit broader. So the one that we'll click into will be nutrition and pregnancy, and the next slide will show us. And all of the entries are framed the same way. You have your table of contents on the left-hand side. The main entry is on the right. There is author information. This is an old slide that I've grabbed from a previous presentation. So it says the last updated was in 2017, but I bet if we go to UpToDate now, it'll be different. But it'll give you the last updated date, so you know how current that particular entry is. And then you'll also find links throughout. So on the bottom of the screen, you'll see healthy diet in adults. That will link you out to other entries. And then on the left-hand side, you'll notice there was vitamin D, or calcium and vitamin D. So that will take you right to that portion in the article, or the entry in UpToDate. So our next poll question is, are you familiar with PubMed, the world's largest biomedical database that you can search for free? PubMed's one of my favorites, even though I have access to so many
Me too.
proprietary things, I still really like PubMed.
Okay, everyone's voted, and lots of familiarity with PubMed. And looks like one who uses it all the time, and a lot of others who maybe not using it super frequently. So great that we're having a little bit of an overview today.
Great. So one thing just to note with PubMed is that they've started using AI for a number of different things. And they've started using it for indexing, which is kind of concerning. The way that things are indexed aren't always correct now. One example that Orvie has is if it finds the entry of, say, somebody clicked a mouse it may classify that item as with mice. So having research methods that are using mice in the research. So, and that is completely incorrect. They've also incorporated into some of their search algorithms, which can have some ethical issues. And they also use it sometimes to create abstracts. So keeping that in mind as you go through your search results, just being aware that AI has some implications in what your search results will look like. So PubMed is freely available. It has over 26 million citations within it. It's fantastic. Articles that have been published are indexed in it. So it's best for journal articles, systematic reviews, practice guidelines. There's so much content that you can be really specific with your searching in it. In some cases, if you have a really specific drug or a really specific condition, then you can be a little bit broader in your search strategy. But for this example, because there will be so much published on it, you can be really specific. Use quotations and keeping your phrases together. Use and or, and to help narrow down your search. And then use your similar terms in brackets with or between to help broaden out so that it's searching for those synonyms. And then once you do your search, you have all of your filters on the left-hand side. So you can limit by date right off the bat. And then you can also choose your article type. So if you were to scroll down a little bit, there'll be a place to choose systematic review and practice guideline. And then all of the entries are in the middle, are the different articles. And right from this initial page, you can see at the very bottom, it says free article. So you can see which ones are open access that you'll be able to get to right away, the full text. But anything that doesn't, again, you can order them through DocDel through us, and we will be able to get you the full text. I will mention too, so right at the top there, there's save, email, send to, and then there's sorted by. I'll usually pick publication date, but there's also one option called best match. And as I mentioned with the AI, that's something if you do choose to sort by best match, which can be fine, if you just want to see, but I would encourage you to try other options too, because it's going to be filtering based on those commonly clicked on articles that you might not really want to be paying attention to. So then once you click into the article, it'll give you all the information about it. It'll give you the journal and the date and the author information. On the upper right-hand corner there, it gives you the link to the open access. Then it will also give you mesh terminology. So, and I'll just briefly mention the mesh terms because it can help you with your search strategy and help build out that terminology. There may be some medical terminology here that you didn't think of. And if you click on one of those, it will pop up with that search in PubMed, search in mesh, and you can add those to your search if you want. So just a few things to remember with PubMed is unlike UpToDate that had that smart searching that linked obstetrics with pregnancy, PubMed doesn't have that. So you're going to be searching for exactly what you've told it to search for. So if you type in elderly, it won't be searching for seniors and geriatric. So with PubMed, finding those synonyms becomes really important. And then the content that you're actually searching when you're searching PubMed is not the full text, it's that article entry. So it's the abstract, it's the title, it's the author information, it's the metadata about the article that you're actually searching. Okay, and I'll throw it back over to Orvi.
Sure, thanks. Gail, I did just have two questions. What happened? So you mentioned that some articles in PubMed, then you can click through to the full text and it's free. What happens if somebody comes across a paywall?
Yeah, then you can even just grab the URL or the citation, email that to us, and then with our Docdel service, we will send you the full text.
Send the full text. And also that search that you gave the example about vitamin D in pregnancy, that seemed pretty complicated. Can you also just put in like
Oh, yes, you can be as simple. You don't have to use your and or Boolean operators and be as advanced as you want. You can just throw your terms in and it will bring back results just like Google would if you
it'll
want.
give you something for sure. And then last question on this one, what happens if they've tried to search PubMed themselves, haven't quite found what they're looking for, but they know that there's more information? What should they do next?
Yeah, for sure. So if you feel like you've done as much searching as you can but you don't want to do anymore, you can just send us a lit search request and we can go through and search PubMed or any other databases that we have access to, and we can send you a list of resources. So
Perfect.
yeah, don't fumble around with PubMed. If you're getting frustrated,
Yeah.
send it to us.
Yeah, thanks. And like Gail says too, if you want to learn how to search better, we've got 2 whole other education sessions just about searching for PubMed. It's our favorite resource because you can get so specific and so precise, and there's so much advanced searching functionality in it. It is not something that we can learn in 5 minutes. So dive in, play around, see what it's like and what's in there. But if you're definitely feeling overwhelmed, definitely reach out. Okay, now thinking to clinical practice guidelines. So clinical practice guidelines are about something really specific, and they provide recommendations intended to optimize patient care, and they're based on the highest levels of evidence. And so when you're looking for guidelines, or guidelines are best when you're looking for specific clinical recommendations, and also when you know there's research available on a topic. So some of our favorite sites to search are the TRIP database, and I'm going to take you there. It's free to search. There is a bunch of advertising in these highlighted things that say pro. And so but just focus on the free stuff here. So TRIP has a much more simplistic search function, more like UpToDate than it does for in PubMed that Gail just showed us. So I'm going to switch topics. I'm going to take us to earwax removal, and you can see it prompted me a little bit. I click on this. What I love particularly about TRIP is on the left-hand side here, it breaks it down by different kinds of evidence types, including guidelines from different countries. So a little bit concerning when you're like, oh gosh, but I have the paid, it's only the paid version that shows me the Canadian guidelines. No, the Canadian guidelines are here. You can still scroll to them. You just have to scroll through them. And you can't, if I click on this, nothing happens. So instead, I can just use Control F and I can search Canada on the page, and it makes me, what is happening here? I have to do it on the side. Oh, this was working yesterday. Maybe I just have to scroll down and it takes me to the Canadian ones. So it's a little fussy to go through, but all the information is here for the guidelines. And the spoiler is that it actually didn't find a Canadian guideline. It just had a guideline that had earwax in one part of the guideline and removal in another. And it didn't actually, there isn't a Canadian guideline on earwax removal. You can also try to use a more clinical term opposed to the lay term. You can see the results are slightly different here, still pulls up those 2 Canadian guidelines. And like with many databases, you can change the order that it's ranked by. So TRIP is running an algorithm to recommend the results to you, but you can do it by relevance or by date. And so really, really simple to use, really, really straightforward. And then if you're interested in something, then you can just click on that result and it will take you out to it. Same, oh, that one had a, if you hit something like that and you're like, I just want this guideline, that sounds great. Just highlight this title or highlight this information. And like Gail says, send it to us and we'll track down figuring out where it actually went to and where it is. So that is, that's a really great way to get those guidelines. It also has a collection of these higher levels of evidence. So particularly if you're looking for guidelines, also a great resource if you're looking for some clinical information. Next up is, of course, Google. And we just want to highlight a couple of tips for you. So Google is best when you're starting a search just to get a sense of what's available. And also if you haven't been super successful with the other sources you've tried, I also like to look at Google when I'm looking for what patients are finding or the public. And it's also really great for things that we call gray literature. So that can include government reports. It's really the reports that I really like to find from Google because they're not in the more authoritative places like PubMed, but reports can still be very, very authoritative. So, and we've got a couple of tips here also. So let's stick with earwax removal for a moment. I'm going to type in earwax removal and you can see it's prompting me for stuff. And so a couple things to note about Google right now. First is here are ads. So watch out for any sponsored content. Sometimes it's helpful. Sometimes that's what you're searching for is things that are for sale and that you want to find that are sponsored. And sometimes not. So just know that comes up. And Google also, if you ask it a question, it has a new thing. So if I say, what is, or if I frame it as how to remove earwax at home, it's going to give me this AI overview. And like Gail mentioned with PubMed, just be really cautious with anything AI relating to health information across the entirety of the internet or any digital mediums in this moment. So depending on what you're doing, this may or may not be helpful. I was having trouble with my iPhone the other day, and I was using the AI overviews were excellent at troubleshooting. I am not going to rely on the Google AI overview for helping like my children remove earwax. I'm just not using this as an authoritative source. So just take that with a bit of caution. AI overview might be helpful or it might be cautious. I always like to skim through and just see, and especially if you're already an expert in this area, this might be helpful for you to see like, oh, this is what they're recommending, or I'd forgotten about that, or whatever it might be. Or you might think, oh my goodness, this is so dangerous that this is what's out there. The other way to approach Google is to, again, like we did in the trip search, is to use a more clinical term. And you'll see right away, I'm getting very different results. The ads are now moved from the top over to the side. And I still have this AI overview, but if I start to click down, I'm getting some pretty authoritative or pretty trustworthy results. So Cleveland Clinic, Merck Manual, Mayo Clinic, some quality images that I can look at. So just be taking all these things into account when you're doing your Google search. We're still very much learning all the changes that have been happening to Google over the last year and a half since they've started really changing up their algorithms to use AI more. So just be cautious and note these changes as they're coming. And a couple other things just to note, Google is not case sensitive. So it doesn't matter if you use uppercase or lowercase. It also, if you search pregnancy, it will do the expansive search for you. You don't have to try to do that really technical search string like Gail showed us in PubMed. And also ranking order of your terms is really important. So if you want to ask it a question and get an AI answer, great, do that. If you just want some authoritative information or to see more results like we're seeing here from Harvard and Kids Health and UCLA and the National Institutes of Health, then just use really specific terms and remembering that the first word is going to be the most important. You can also use quotations. I'm just going to switch back to our slides here for a second. You can also use quotations. Sometimes this is helpful if you're searching for a specific phrase or something really, maybe a specific technique. Use those quotations and then Google will will only give you results that then are for things like vitamin D supplement. And quickly screen results. Oh yes, and then you can quickly screen those results as I already was doing just out of habit, which is just quickly look at where are the kinds of results, what are the sources that are coming up in this result list. So poll, if my computer is gonna work here, I will launch this poll, and I've also noted that there's a question in the chat. So while you are completing the poll, I will double check the chat here. Okay, so everybody, oh, almost everybody's answered. Okay, seems we've got a real super user with us. They're searching Google Scholar all the time, and a couple who maybe have dabbled a bit or have some familiarity. So that is great. Thanks for letting us know. The question in the chat is, can we get direct access to the articles and just log in? So unfortunately, that is not something that is covered through MyNet at this time. Just let us know what articles you're interested in, and then we can send you those full text results. And that's not because we're trying to be gatekeepers, that's just a funding issue. Purchasing access to all those resources is really expensive and not something that the Manitoba Health or the regional health authorities have prioritized in their funding yet. Okay, so just quickly in Google Scholar, it looks again very similar to Google. We can try our earwax removal question here. It looks like Google results, but it's more of the type of results that you would find in PubMed, plus a whole bunch of other stuff. So you can see here, we've got from Sage Journal, so some journal articles, and you'll also find reports in Google Scholar, and as well as you'll find presentations and thesis and dissertations and all kinds of other scholarly kinds of material. I tend to only go here if I haven't had success in PubMed or because as you can see here, like the first result is from 1998. I don't know why that is. Probably because AI has read it as being current challenges, but hasn't understood that this is an article from 1998. So I, again, would use PubMed over Google Scholar, but there's no right or wrong. Just and you can do a couple of different limitings on your things. And if you're familiar searching in Google and you're looking for some more research articles, then this is a great next step for you to give it a try. Okay. And then just like we've been mentioning throughout, if you're not finding what you're looking for and you're like, gosh, I know this is just, there's too much, or I'm not finding anything, or anything in between, just let us know. We're happy to pick up that search for you. And again, if you hit that paywall, just let us know what the articles are that you want, and we send you those full text. Okay. Gail's gonna take us home here.
Okay. So our last step is critical appraisal. So just because you found something on PubMed and it looks to be good, doesn't mean that it necessarily is. Should still be doing that evaluation process to make sure that the research methods are sound and that the evidence being presented is quality evidence. So there's a few tools that you can use to help you evaluate resources. So the CRAP test is one of my favorites, and it doesn't matter what subject you're working in, doesn't matter if it's high school students or middle school. I use this with my daughter in her research projects, right up to medicine. It works for everything. So the acronym here, the C standing for currency, you're going to be looking at that publication date. And this is what's current is going to change depending on the topic that you're looking at. I like to use COVID-19 as an example because typically with health information, we'll say the past 5 years. But with COVID-19, you can't really say 5 years. If you're looking for immunization information, maybe 6 months is the most that you want to be looking at. So you really want to be aware of when things were published and how it fits in with your topic to make sure that you're getting the most current information for the topic that you're doing your research in. Reliability. So looking at the data that's being used within that research study, are the research methods sound? What are the citations that are being used? What information are they using to support? What evidence are they using to support? Authority. So looking at the author, what are their credentials? What's their expertise? Are they a GP versus a cardiologist? You can also think about the publisher who's publishing it. Are they well known within medicine? You can think about the journal title as well. Is it JAMA? Is it New England Journal of Medicine? Or is it something that you've never heard of before and you need to go to their website and figure out how long they've been publishing for and who their editors are to be able to determine whether they're reliable or not. And then purpose. So is it a pharmaceutical company behind that research or an environmental group? Do they have a vested interest in a particular outcome for that study? So you want to be aware of the particular point of view. And then on the right-hand side here, this graphic, it's sort of like translating that CRAP test into some things to think about for kind of social media type stuff. So same thing, consider the source, read beyond. So are there grandiose statements being made? Supporting sources, what kind of evidence is being used? The author, checking the date. Is it a joke? That's a big one. And then check your bias and ask the experts. Are there, is there a website which assesses the quality? Orvi, there used to be, and then it was defunct, a website in terms of the quality of journals.
Yeah, there's not really one specifically. And even within journals, like good journals can publish articles that aren't authoritative or aren't reliable, and vice versa. Sometimes really good information is published in a lower quality journal. So the best way is to just critically appraise as you go, and try to stick with really authoritative places. Like PubMed, more authoritative than Google Scholar. Again, PubMed not perfect. Lots of stuff sneaks in there. But yeah, best to critically appraise on an article by article level.
Yeah, and then journal ranking as well. I don't know if it's if there's a publicly available one. So if you want to know that journal ranking for a particular journal title, you can always send that question to us, because Scopus, I think. Yeah, Scopus is where I will usually go through, but it's a proprietary website, so you may not be able to access that information yourself. So, but you can send that question to us and we can look into that for you. Absolutely.
Yeah, and similarly, if you have found some results and you're not sure if they're of a high quality, we can also help you with that as well. And there's another question in the chat about, are there any fact-checking sites that we particularly recommend? I know that in the past there's been a couple of ones that have been okay, but right now, I'm not sure about you, Gail. There's nothing in particular that I'm using like broadly.
No, I would usually just go right to up to, like, if it's a medical question, I'd go to UpToDate or PubMed to try and find something, some broader article or a practice guideline or something, and do the searching that we've talked about.
Yeah.
I don't know of anything that I would trust that would give a really quick answer.
Yeah. And I think just recognizing the state of the world right now with AI, there's a lot of things that are really untrustworthy, a lot of things that are spoofs, a lot of like there's a lot of money in quality evidence and in research publications. And so people with all kinds of different motives try to replicate those and spoof them. And then we have, daily or hourly announcements about defunding or pausing funding on some really like some of the the English speaking world's most reliable sources of health information are a little bit under attack in this moment. So we just recognize that it's a bit of a scary time. And more important to critically appraise, I think, now than ever before. And we're here to help with it. Yeah.
Yeah, for sure. And then Critical Appraisal Skills Program is also a really great website. That they have a great website that have a number of checklists. So if you aren't sure what constitutes a good systematic review or a great clinical trial, they have a checklist that you can open up that document and actually go through. And it's really easy to use. It's kind of yes and no questions. And then you can determine whether that study has been done well or not.
And we have in the past, so I did answer in the chat, yes, our past education sessions, the recordings of them are available on our website. And we do have an older one about critical appraisal that does go through some of these tools in far more depth. So that might be one to check out. And that's also one that I've jotted down as one that we might want to offer later this year, because sounds like critical appraisal and spotting fake things and debunking things, that kind of thing is maybe of interest and maybe timely. And we're always looking for input as to things that you're interested in that we can help connect you with these quality resources.
Yeah, and then just with critical appraisal, again, a last note on AI. There is so much content that's being created in libraries, coming across AI creating fake citations even, and then our library staff can't even locate something. So keeping in mind that AI is being used in search algorithms, it's being searched in abstract construction and subject heading indexing, and all of that affects your search if the wrong terminology has been associated with the wrong article. So it makes things quite difficult. But so in review, so the 5 steps for finding health information. Number 1, make sure you're asking a specific question, using that method to help you flush out what it is that you're really looking for. Then 2, create an effective search strategy. So using the thesaurus, finding those synonyms, using finding that medical terminology versus layperson terminology, and really constructing that word map of terms. And then identify the best sources. So determine where you want to search, if UpToDate makes sense, if Google Scholar makes sense, or PubMed. And then do the actual search for the information. But at any point, if anything's frustrating or you just feel like you're not finding what you want, contact us and we're happy to help. And even search some of those proprietary databases for you, which may lead to even more information. And then last step being making sure to critically appraise your final results and what you decide to use in the end. And then here's just our contact information. So if you have any questions, feel free to reach out. We're happy to answer any of your questions. We have our contact information there for our regular Minnet email and phone number. And our website is also there. We have a lot of toolkits and information on our services. So feel free to check all of that stuff out.
Yeah, and we will be following up with a handout of just some of the key things that we've talked about today, so that you can have those as a ready piece of information for you going forward. So that brings us to the end of our prepared content for today. We really appreciate you tuning in and being here with us. And we are available for any questions that you might have.